wanted to make this 3 o'clock realizable, but sometimes because of the exigencies of duty, we keep getting it extended. Sorry about that, but in spite of that, I welcome you all to the briefing for Monday, 27th April 2020. Today marks the 28th day of the cumulative lockdown order by Mr. President in Lagos and Ogun states, as well as the Federal Capital Territory. The Presidential Task Force has continued to assess the situation nationwide, and an appropriate report has been submitted to Mr. President, as well as the fact that the Honorable Minister of Health and the Director General of Nigerian Center for Disease Control have equally briefed Mr. President. It is expected that once a decision is made, the President would address Nigerians on further measures to be taken later today at 8 p.m. I urge all Nigerians to be on the lookout for the broadcast. The Presidential Task Force shall continue to pursue the strategy of aggressive testing, detection, isolation, contact tracing, care, and management. Similarly, non-pharmaceutical measures will be enhanced. Over the last 4 weeks, we have made appreciable progress, but we are not yet out of the woods because a lot more is required to be done. Nigerians at all levels must take responsibility for our actions, adopt behavioral modification, ensure compliance with advisories, and provide guidance to our followers and the youth. The situation in Kano is being addressed very closely by the Nigerian Center for Disease Control in strong partnership with the state government and guidance by the Federal Ministry of Health, as well as support from our development partners. Let me register the appreciation of the Presidential Task Force to the media for ensuring that Nigerians are kept very well informed about actions of government and for creating the necessary awareness. Similarly, I want to thank our frontline health workers and administrators again and again who have been working to keep every Nigerian safe. Your professionalism and commitment are well appreciated, and I urge you to continue with strength and vigor. Finally, let me remind all Nigerians that the fight against COVID-19 is a fight for all of us. It is only when we unite that victory can be assured in the next phase of this fight. It is time for us to individually and collectively take responsibilities for the next steps that we are going to take in the days and weeks ahead. I now invite the Honorable Minister Health to present his update. And I want to thank you most sincerely for listening. Thank you.
Thank you very much, Mr. Chairman and my colleagues in the PTF team. Distinguished ladies and gentlemen, today is the 27th day of April 2020, and it marks 2 months since we recorded the first case of COVID-19 in Nigeria. That first case was on the 27th of February with the Italian index case. Since then, we've recorded 1,273 people in 32 states and Federal Capital Territory that have been confirmed positive for COVID-19. The 91 latest infections are as follows: 43 in Lagos, 8 in Sokoto, 6 in Taraba, 5 each in Gombe and Kaduna, 3 each in Bauchi, Edo, Ondo, Oyo, Rivers, and FCT, 2 in Osun, and 1 each in Bayelsa, Ebonyi, and Kebbi. 239 persons have been successfully treated for COVID-19 and discharged home, but sadly, 40 deaths have been recorded so far. The rising number of cases is of concern to all, but there is evidence of increasing in-country community transmission, which to a large extent is as a result of non-compliance with lockdown orders and other non-medical interventions. Another presumptive source of exposure to infections is the unauthorized treatment of highly contagious COVID-19 patients in private homes or unaccredited health facilities, with risk of infecting their families, other patients, visitors, and health workers. These factors necessitated the ongoing active case-finding strategy with house-to-house and cluster testing, which has contributed to increased case detection. We have now activated 2 additional labs in the COVID-19 network. Usman Dan Fodio University Teaching Hospital, Sokoto, and Ahmadu Bello University, Zaria, bringing the total number of labs to 15. All states have been supplied with medical consumables to support preparedness and response activities. There are concerns about the steep rise in the number of persons diagnosed with COVID-19 in Kano State. You sadly included members of the State Emergency Operations Center, along with reports on a reported spike in the number of deaths over the weekend. The federal government, through the Federal Ministry of Health, is deploying a high-powered fact-finding delegation to work with the state to improve COVID-19 response, as well as ask questions on the causes of these deaths reported. However, His Excellency, the Governor of Kano State, Governor Ganduje, as well as the State Public Health Department, who will receive the delegation tomorrow, will brief the team as appropriate. While wishing all citizens well, particularly those who are presently observing Ramadan, I shall reiterate the usual public health advisories. Stay at home, avoid large gatherings, especially during iftar. Practice physical distancing by strictly maintaining a distance of at least 2 meters, that's about 6 feet, between people always. Use non-contact greetings such as waving, nodding, or placing a hand over your heart. The elderly and those with pre-existing medical conditions such as cardiovascular disease, diabetes, liver disease, kidney disease, chronic respiratory disease, and cancer should avoid receiving non-essential guests, especially at close quarters at this time. And of course, the use of masks or face coverings over your nose and mouth if you must leave your home is highly recommended. We are engaging traditional and religious leaders, other faith-based bodies, civil society organizations, and other sectors for the increase risk communication messages to communities. Arresting the spread of this virus requires our individual and collective effort. Finally, I would like to speak about calling for medical help. If you suspect or someone around you has been exposed to COVID-19, call the toll-free 112 number. There have been unfortunate reports of persons who suspect COVID-19 in critical condition, losing valuable time in trying to contact NCDC for a test. We are in the process of setting up an emergency ambulance response system to address such issues. If your symptoms are mild to moderate, you can afford to isolate at home while awaiting a test and the result of that test. However, if you are in medical distress, such as difficulty in breathing and in need of urgent medical care, please call your state emergency number where available, or call the Federal Tertiary Health Institution nearest to you for help. In such cases, whether or not you have COVID-19, there is a need for prompt medical attention. You cannot afford to wait for a test result. Resources and real-time information on COVID-19 can be found on the social media handles of Federal Ministry of Health and NCDC. The Federal Ministry of Health website and the NCDC COVID-19 microsite covid19.ncdc.gov.ng. Before I quit this podium, you will recall that the chairman of this COVID, the Presidential Task Force, did ask that at appropriate time, you will be apprised of the measures that government is putting in place at the federal level to assist the health workers. So I will just read out briefly what these measures are. Hazard allowance. The federal government has agreed to shelf the payment of existing hazard allowance of 5,000 being paid across board to health workers hitherto. This is what had been in existence since 1991. In its place, a special COVID-19 hazard and inducement allowance of 50% of the consolidated basic salary is to be paid to all health workers in federal government teaching hospitals and federal medical centers, and have designated COVID-19 centers and primary health care centers to last for the first 3 months in the first instance. B, 40% of the consolidated basic salary will be paid as special COVID-19 hazard and inducement allowance to health workers at special non-public hospitals and clinics in the federal ministries departments, and agencies for the same 3 months period in the first instance. 20% of the consolidated basic salary will be paid as special risk allowance. Additionally, on the special COVID-19 hazard and inducement allowance to all health workers directly managing COVID-19 at the infectious diseases hospitals, isolation, and treatment centers. D, 10% consolidated basic salary will be paid to non-core medical professionals working in health sector and operating at aforementioned hospital clinics as special allowance for COVID-19 period for the first 3 months. What we're saying here is that there are people who are not directly involved in patient care, whether at the isolation centers or the treatment centers, but they still work in an environment that puts them at risk. That it will only be fair to consider these people as well and encourage them one way or the other. Number 2 here is insurance. There's a group life insurance and employee compensation. The health workers noted that the federal government has paid and activated group life insurance for all categories of workers in the public service with 13 insurance companies, but urged the federal government to ensure full payment for the cover to last for 1 year. The federal government of Nigeria is urged also to fully reactivate the insurance policy for employees under the Employees Compensation Act to cover for infirmities, critical illnesses, disability, and death in the course of managing COVID-19 cases. These 2 insurance covers, which are for all federal public servants, especially health workers for COVID-19 and post-COVID-19 period for the next 1 year, is guaranteed. The Presidential Task Force on COVID-19 has been requested to provide additional insurance cover aside the above listed for frontline health workers at infectious diseases hospital, isolation and treatment centers. Just a bit of explanation here. What is being said here is that something can also be done by way of insurance by PTF, because what I read out earlier is what the federal government is doing in line with the service protocol, if you like. In addition, the Presidential Task Force is urged to dedicate all the life insurance donations to volunteers and National Youth Service Corps health workers. Now, what is meant here is that the groups that I mentioned earlier on, they are civil servants in the federal civil service. But there are people who are volunteers and have been called out, either retired or just volunteering on their own, who are not covered within the civil service scheme, and youth corpers as well, who are not covered within that scheme. But the chairman did announce here some time ago that some insurance companies, they came together to donate certain insurance covers to the PTF. So what's being said here is that these insurance covers will be for such people who are not captured within the Federal Civil Service scheme. Then the issue of retirement, review of retirement age for health professionals. The request for retirement of health workers to be moved up to 65 years, and that of medical doctors, consultants to 70 years was discussed. And we'll let you know who discussed this. The government agreed to look into this post-COVID-19. However, in the interim, government agrees to grant extension of service for a period of 3 months in the first instance for health workers retiring within the COVID-19 period. So what has been said here is that if somebody is due for retirement and is a health worker, it's not the best time to let that person leave. When we are about it's like a war period, that is not the best time to lay people off work or to allow them to go, if they so wish to be part of the rescue effort. This extension period for 3 months in the first instance will not count as pensionable period of service. And number 4 is tax rebate. Government agrees to a tax waiver on special COVID-19 hazard allowance and will consider same for call duty, specialists, and ship duty allowances for 3 months in the first instance during the COVID-19 period. What this means is that we won't want to create a situation where you give something with the right hand and you take it back, with the left hand. That these allowances would not be taxed. That's what's been said here. Then personal protective equipment that the federal government through the PTF and Nigeria Center for Disease Control agrees to scale up the provision of PPEs to all health workers in the federal tertiary institutions and extend same support to state governments in order to protect health workers. Of course, we do know that even the insurance companies will insist that PPEs are given to all health workers. It's a kind of precondition. And finally, is to say that the federal government agrees to bring all these measures of motivation of health workers to the attention of all subnational governments for their guidance, information, and necessary action. Now, I did say earlier on that you will know who this we. This meeting, where we agreed to all these terms as stated, was attended by the Honorable Minister of Labor and Employment, Dr. Chris Ngige, myself, Minister of State for Health, the Acting Chairman of National Salaries and Income Wages Commission, the President of the Nigerian Medical Association, Dr. Francis Faduile, the Deputy President of Pharmaceutical Society of Nigeria, represented by Pharmacist Mune Ilelu, and the General Secretary of the National Association of Nurses and Midwives, represented by T.A. Shetima, and the National Chairman of Juhesu, Bubelimoye Joy Josiah. So we sat down to discuss these things, and we agreed. We agreed through this MOU, signed on to by all the appropriate officials, and of course ratified by the PTF as a body. And I was privileged to have been the one saddled with that assignment. Thank you very much.
Thank you, Honorable Minister of State for Health. We take the DG and CDC.
Chair, members of the Presidential Task Force, ladies and gentlemen of the press. This morning, there's no other issue that is probably on the forefront of your ideas other than the situation in Kano. So we've decided to take this head on. There's been a lot of conversation about the situation in Kano, but first I'd like to remember that remind everyone during a pandemic, the risk of spread is in those towns where the population density is the highest. We understand, we're all aware of the population density in Kano, so Kano has always been very high on our radar. So the high number of cases that we're now seeing in Kano is really not a surprise. We're very concerned about this. We're very concerned about this, and we're doing everything we can. Now, despite our strong commitment to quickly control the spread of the coronavirus, there's no magic bullet. There's no magic bullet. If anyone has one, I'll be happy to get it. But as much as there's been this conversation, our role is to continue to work very hard. Work very hard on behalf of everyone. Work very hard for the people of Kano and the people of every state in the country. So what exactly are we doing? Now, firstly is to mention that, Kano has been one of the states with which we've had the strongest relationship with at NCDC. There's no single state I've visited more often since I became the DG in 2016 than Kano. So we have a strong relationship with the public health leadership, with the commissioners, and we've had over the past few years. And again, just last week I visited with Kano State and met His Excellency, the Executive Governor of Kano State, Dr. Abdullahi Umar Ganduje. And we had very fruitful discussions, very open, very fruitful, in recognition of the difficulties in Kano and a commitment to continue supporting. Now, within the first 12 hours of the first confirmed case, we had already deployed a national response team to Kano to support the state government's effort. We now have a total of 15 people in Kano, and we will continue scaling the number of people supporting Kano State until we get to the appropriate number. Just maybe 10 days ago, I announced the activation of the lab in the Aminu Kano Teaching Hospital. We did everything possible very quickly to activate this lab to reduce the turnaround time for the testing of samples. But sometimes speed also has consequences. And in this particular case, unfortunately, we had an incident where the lab was contaminated and biosafety measures had to be strengthened. So in the interest of all the healthcare workers in Kano, especially in AKTH, we had to pause and shut down that lab for a few days. And that is exactly what we did. So we've been working together with people, with our colleagues, to reactivate this lab, but we have to do this safely. In the last 72 hours, we sent another team from the National Reference Lab of the Nigerian CDC. They have worked day and night over the weekend to reactivate that lab, and I'm happy to announce that that lab will start working this afternoon and start testing samples again as they should be. This has not been an easy effort by any stretch of imagination. It has taken the collective effort of my team, the laboratory scientists in Kano, colleagues that we have recruited in an ad hoc way, and many people that have quietly worked on this to make it happen. We will not stop till the lab is fully functional again. We're also working with a new lab in Bayero University, Kano, so that we have two labs working concurrently in Kano. So right now, everybody is working very hard to get the lab working because we are very aware that the lab really is the window into the response. So we remain focused on our targets. Our focus this week is to rapidly scale testing across the country. And I'm happy to announce that in addition to Kano, today we're activating the high throughput Roche machine in the National Reference Lab that will enable us an extra capacity of about 1,000 samples a day if we can get the samples in. So we're working to get in the samples from across the country. We're also working very hard to investigate the causes of the deaths that have been reported. Now, mortality surveillance is not easy. So we're working to do what we call a verbal autopsy retrospectively and prospectively together with the public health team in Kano. That is very diligent work that is going on at the moment, and in a few days or a week we'll be able to produce the initial results. We continue to work in collaboration with the Kano State government and recognize the strong leadership of the state. These are difficult times. People have lost loved ones, families have lost loved ones, and businesses have closed. So we understand the difficulty being faced and the challenge and the anxiety. But we will not stop till they get to the bottom of this. So our philosophy at NCDC has always been to consider the states in Nigeria as our primary clients. No states, the bigger states for the work that we do, always pose specific challenges, and we therefore have to put in extra resources to them. We will continue to work very hard, recognizing that there's no magic bullet to solve this problem. It will take more time, stronger collaboration and support from all of you. Our work is to put our heads down and continue. We will not be distracted by any politics, any insinuations. We will continue supporting the people of Kano and the government of Kano State to get ahead of this. This is a time for collaboration. This is a time for leadership. This is a time for solidarity. It's not a time to point fingers. Our work is cut out for us, but we're not running away. We remain committed to achieve the task that we've set out for ourselves. We recognize it's a marathon, not a sprint, and we are committed to the mandate given to us at the Nigeria Center for Disease Control. Thank you very much.
The Secretary to the Government of the Federation, Honorable Ministers, members of the Presidential Task Force on COVID, ladies and gentlemen of the press, good afternoon. I think a lot has already been said about Kano. Just wanted to further add that we have been working very closely with our partners, specifically the UN system and the US government, to ensure that all aspects of the Kano response, particularly where we are having difficulties in terms of testing, in terms of access to patients, in terms of logistics, is sorted. And I'm very grateful to our donors for coming together and making sure we have a very coherent response. I will again emphasize the message to the people of Kano. You are not alone. The federal government will continue to take its responsibility seriously, and we will continue to work with the state government and other stakeholders to ensure that the issue in Kano is sorted out as soon as possible. With regards to other issues, particularly as it relates to the state chief executives, I am, on behalf of the PTF, appealing to state governments to please continue to support the existing structures, particularly the state emergency operating centers and their chief executives as well as their staff. These people are at the front line of the pandemic. They need to be supported 100% to be able to deliver their work. And specifically, we would like to re-emphasize that there is no limit to testing. There is no limit to testing when it comes to COVID. COVID numbers is not an issue of competition between states. There is no shame if a state comes up with positive numbers. In order to deal with an epidemic, we need to have transparency in numbers. And that transparency is linked to the number of tests. If you do not know the extent of your problem, you will not be able to deal with it. So I'm appealing to state governments to please continue to support the state emergency operating centers, the state ministries of health, to make sure that everybody who needs to be tested for COVID in any state in the country has that opportunity of having the test done. In addition to this, we would like to further remind state governments that there are a number of states that continue to have inadequate bed capacity for isolation. Now is the time to correct this before the numbers start going up. So please, the state chief executives, I'm appealing to them to please make sure Where you do not have adequate isolation facilities to do so, the PTF has already put 300 as the expected minimum number of isolation beds that should be available in every state. In terms of public awareness, we continue to intensify efforts to support the fight against COVID-19 across the nation. We have reached out through a sensitization campaign, working with our traditional and religious leaders, as well as existing health structures such as the polio eradication program, to reach the grassroots with our messages. The task force is also implementing training programs for health media reporters on effective messaging and COVID-19 reporting. Finally, I would like to encourage Muslim faithfuls to continue to comply with Ramadan protocols. The task force continues to run communication campaigns down to the grassroots on observing the holy month of Ramadan in the safety of our homes. Thank you.
Thank you very much. That brings us to the end of the updates. While the updates were being taken, two important guests came in. It's a symbol of a collaboration between the executive and the legislature. I'm pleased to announce the presence of Dr. Ibrahim Oloriegbe, the chairman, Senate Committee on Health, and Senator Sadiq Umar, the vice chairman, Primary Health Care and Communicable Diseases Committee in the Senate. Distinguished senators, you're welcome. We shall now take the questions. I hope our colleagues are ready. Okay.
Good afternoon, sirs. My name is Friday Okerebe. I'm a reporter with Channels TV. I also like to take us back to Kano, even though a lot has been said about it. It's actually, the situation there is something that is so disturbing to a lot of persons, and I'm sure it's also disturbing to the PTF, members of the PTF. Now, I would like the DG of NCDC to respond to this. Last week, you were in Kano. And just during the weekend, the minister said, which was also reaffirmed, that the PTF is sending another delegation to Kano to find out what is actually happening. You've also established here that there is robust communication between the PTF and the state government. What information do you have for now? What information are you receiving from the state that could be kind of an explanation to what is happening in Kano, before we wait for the feedback from those delegations that are sent to Kano? What information do you have for now? The second question too is also directed to the NCDC bus. It has to do with the amount of test kits that we have. When we started the briefing here, you told us that we have within the neighborhood of 30,000 test kits. How many of them have we used? How many do we still have now? Because on your Twitter handle, you actually used the word desperate, that we are in desperate need of test kits. Have we been so depleted that we are so much in need of test kits? How many do we have as we speak? The third one is a follow-up to the question I asked last week, which was a kind of outcry from the senior citizens, pensioners. They've actually written to the SGF, Secretary of the Government of the Federation, making a strong appeal for their pensions to be paid because they are worse hit as we speak. Many of them are above 60, 70. But particularly this weekend, pensioners from the Federal Mortgage Bank in Abuja here, it was so pathetic. If you saw them, I'm sure you will pity them. They said they've not received payment for the past 3 months of their pension. And they are asking, they've not received palliatives, they've not received pension. They are asking, how does the government want them to survive? So it's a question, what plan do you have for our pensioners who are actually in the age bracket of very vulnerable people as we speak? Thank you.
Good afternoon, Ma. My name is Juliana Taiwo Balonye. I write for the Sun newspapers. First question to Minister of State for Health. Hospitals and health workers have been accused of closing their doors to patients suffering from other diseases for fear of coronavirus. What are you doing to address this? Minister of Humanitarian Affairs. Would like you. Okay. Sorry, sir. I said hospitals and health workers have been accused of closing their doors to patients suffering from other diseases for fear of coronavirus. What are you doing to address this? Minister of Humanitarian Affairs, would like you to react to reports that the rice distributed as palliatives are unhealthy for consumption. Are there plans to replace the ones already returned? And then your ministry has also been accused of diverting payment meant for NPAL beneficiaries for palliatives. Would like you to address that. Then, just to add to the question directed at the NCDC, what is really the issue? Is it that there are procurement delays? I mean, for the test kits, are there procurement delays, or are we looking at inward to manufacture some of those test kits? Thank you.
Mr. Chairman, sir, members of the task force, my colleagues, good afternoon. My name is Nancy Oyedia, or I'm from MIT. Minister of Humanitarian Affairs, Ma. Some Southwest governors who received palliatives from your ministry have rejected some of those things, saying that they were weevil infested. So I want to know, was it that it wasn't checked or it wasn't good for human consumption? Just to reiterate what she said. Mr. DG, sir, you've been to Kano and you're back. I want to know why it's taking so long for us to ascertain what exactly is killing people in Kano State. You said we have, I think, till next week to find out. Should people continue to die before we find out what exactly is going on? So some of the numbers also in Kano State are not tallying. We've heard a lot of people say about 600 people have died. Some say 150 people have died. But most of these numbers are not reflecting in the numbers that you reel out every day on the NCDC website. And finally, to the coordinator, sir, really asked on this platform about banks not working. And a lot of people have come to say that they haven't received their salaries because the management of their company said the banks are not working. So I want to know what exactly is going on. Thank you.
Good afternoon, Chairman, Ministers, my colleagues. My name is Nancy Anika from Region Nigeria. My question is to the DG and CDC. It's a follow-up of Friday's question. Last week you said we are able to test 1,500 per day, and then your Twitter handle said we are in dire need. I'm just a bit confused. Want to know, are we in need of testing kits or not? And also want to know if there are particular ways to take sample. This is regarding the Akwa Ibom epidemiologist who was sacked for taking 31 tests instead of 10. Would like to know if there's a particular procedure. And to the Minister of Health, like my colleague earlier said, most general hospitals are close to other kinds of illness, except it's an emergency. But private hospitals are open. But what they do now is demand for PPEs from mothers who want to give birth or those who are there for other things. How do we address this? Should residents be paying for the lack of PPEs in the country? Thank you.
The SGF, sir, Honorable Ministers, DG and CDC, and my colleagues, good evening. My name is Rahila. I report for Voice of Nigeria. My question is directed at the NCDC boss. Recently, Senegal has invented a rapid test kit, which enables it to test almost all the citizens in the country. Now, in the face of shortages of test kits in Nigeria, are we looking inwards to develop developing our own test kits. Thank you.
The Chairman, National Coordinator, members of the Task Force, my colleagues. My name is Amaka Ode. I report for Arise News. And my first question really is more of a clarification from the Minister of State for Health. Well, you've told us about the hazard allowance as well as the insurance. Is this already implemented or is this a commendation? We really need that clarification if it's already taking off or there's going to be a future date for that. And the next question really is for the Minister of Humanitarian Affairs. Well, I do know that you've told us here that you've handed over the responsibility of distribution of palliatives to the state government and the FCT administration here. But what checks have you put in place to ensure that the truly vulnerable and the poorest of the poor get these palliatives? Because I don't know about you, but there's hunger in the land, and we really need to address this before it becomes worse than what it is right now. And the next question really is to the DG of the NCDC or the Minister of Health, State, really. We've seen a lot of stories in terms of people who want to get tested. Probably they've shown a lot of the symptoms for COVID-19 and they get to the hospitals, they're turned back. Are we thinking of readjusting our protocol as it concerns who should be tested and when? Because there are stories, I'm sure you've seen some of them, where some people will tell you that even before the help comes, we've lost some people. So what are we doing to ensure that people are promptly tested? And of course, we don't see more fatalities from COVID-19 related issues. And finally, really, the DG of the NCDC, I'm still going to talk about testing because experts around the world are saying Nigeria, we're under testing, really. And of course, we've seen experts in the health sector speak about, involving more private labs to help us test. But you are the expert. Can you explain to us the biosafety requirement for testing facilities, especially as it concerns private laboratories or even upscaling the ones in the government hospitals and just allowing more people to test for us, because honestly, we need to do more. Thank you.
Good afternoon, all. Rachel Abuja from the News Agency of Nigeria. My first question is to the SGF. So according to the 1999 Constitution, as amended, guarantees freedom to movement and settlement and association as well. In view of this, the action by the Kano State Governor relocating Almajiris back to their states, I believe that's breached our constitution. Also, my next question is for the DG NCDC. Sir, now that we have the Roach Copas 1800 platform, which you said has been validated and is ready to stream, having just received 15,000 test kits, what plans do you have in place to ensure that samples collections and to ensure that samples transportation medium needed to transport the samples to the testing labs are enough to fully optimize the capacity of the machine? Meanwhile, what guarantee do we have as a nation at this point in time that we will not run out of these critical items again? My last question is for the Minister of Humanitarian. A lot of women kept complaining about not receiving palliatives. I would like to know how many, let's say, CSOs and NGOs for women you worked with in distributing these palliatives. Many thanks.
Good evening, Chairman and members of PTF. Good evening, my colleagues and Nigerians watching at home. My name is Amarachi Wanguma from Voice of Nigeria. And my first question goes to the SGF, sir. Last week you made us to understand the plans of the federal government to provide medical life insurance for health workers involved in the war against COVID-19 in Nigeria. And I will take from one of our veteran broadcasters, Eugene Abu, who actually brought something up in the media, in social media sometime last week, regarding the plight of media workers, who are also at the front line and are committed to bringing the stories for as long as it takes. We also need support in times like this. The media owners should as well try to put things in place to protect their staff and ensure that these palliatives that we're talking about, bonuses and provisions, are as well made so that we can do our jobs better. And my take and my request here is we should be carried along. The media workers, there should be, I suggest there should be policies for the private sectors as well as those of us in the government organizations for medical and life insurance for media workers. Thank you, sir. And my last question goes to the Minister of Health, State. Sir, when you were making a breakdown of the cases, the new cases on COVID-19 that we got so far, Imo State, the index case in Imo State was not among your list. I want to get a clarification from this. Do we really have an index case of COVID-19 patients in Imo State from Federal Medical Center Owerri? Thank you, sir.
Thank you. We've taken all the questions. They have been directed at the Honorable Minister of State for Health, the DG NCDC, the National Coordinator, the Honorable Minister, Humanitarian Affairs, Disaster Management and Social Development, and the SGF. We shall begin with the Honorable Minister of State for Health.
Thank you very much, and I want to thank those who have had opportunities to make interventions. I think the first question to me came from Son. The question is, there is an allegation that hospital workers, they are running away, so to speak, from attending to patients because of the fear of COVID-19. Well, that's why I put it as allegation. But if it is true, then part of my submission earlier on about that, which is assuring our health workers that they will be properly kitted, because this is the most important thing that will make them be comfortable. That is, PPEs must be made available to health workers who are attending to patients, because as at the point of seeing patients, you may not be in position to determine what that patient is coming with, irrespective of what the symptoms are. We do talk of cough, fever, breathlessness, and all that, but we have seen a number of cases that probably all they present with is a loss of sense of smell. They cannot perceive smell. So it's not all the time you have typical presentations. So you do have a typical presentation a number of times. So that's why we need to ensure that they are properly kitted, and also for them to also have a high index of suspicion. So we always want to alert their mind to this kind of situation. So as much as possible, we will ensure that our public health workers, they are properly kitted in terms of PPEs so that they are not unduly exposed. I think it's a similar question asked by the second person, the lady, but in this regard, she was asking that is it true, or what are we going to do in respect of pregnant mothers being asked to come to hospitals with PPEs? Well, we will look into this and establish the veracity. Some of these things could just be on social media, which are not necessarily true, but we will try and establish the veracity of this. But at no time has any health institution been asked to demand for PPEs from pregnant mothers or any other patients. These are things that are supposed to be supplied to them, but we'll look into it. Then I think the question from Arise, I think the question is whether what I presented earlier on was just a recommendation. It is not. It is in operation. You recall that I did say that that's why we had to bring in the Minister of Labor and the Chairman National Salaries Wages Commission, because this is in tandem with the service provisions, federal civil service provision. But what we just did was to tinker with what it had been, particularly the issue of a 5,000 naira hazard allowance, which I did say started in 1991, that there is no way that can be applicable for this period. And what has been done is to raise that up and make it a percentage of the basic salary. And it's on. It's been agreed on to, and it's also agreed to by the Federal Ministry of Finance. So we sat down with these various groups in the health sector, the doctors, the nurses, the laboratory scientists, and all others, and of course Johesu. So we sat down to negotiate these things with them, which has been agreed on to. And then because I was asked by the PTF to take up that assignment, I reported to PTF and PTF ratified it. So that's the situation. Of course, other issues like the Employees Compensation Act, it's within the realm of even international labor practices, so it's been there. But the funding is what needed to be addressed, and that has since been addressed. So it's operational. Yeah. I think the last question is, I just want to, please permit me to just look at those figures again, because she wanted to know whether the IMO figures, well, from what I have here, IMO, I'm sorry, I just need to check that from the records here. You were asking whether I mentioned IMO or not. I thought I did. One case, yes. One case in IMO. Thank you very much.
So thank you very much. Very good questions. So Friday, you want more information on what is happening in Kano? Unfortunately, our work is not black and white. It takes time, right? So we're doing our very best with the teams in Kano. As things evolve, you'll be informed on where we are. This is basically what I have to say. The team is working very closely with the Kano State team. Every single day they go out into a very complex, densely populated but great historical city to find out what is going on, to take samples, send them into the lab. I have to trust the work that they do, and you have to trust that the work they do, they're doing on your behalf. This is not easy work by any means. If you want to go to the field, we're happy to send you to the field to go and find more information out and feedback. But this is really where we are. I'll continue to try and support you and your colleagues with all the information that you need. Now, on my tweet on Saturday, one thing I'd like colleagues to understand, I asked for something called extraction kits. They're not the same thing as the test kits. So sometimes in life, you have to be honest with yourself. We have a supply chain of all the commodities, but there are supply chain challenges in things coming into the country now. It's not a surprise to anyone because of this is a consequence of the situation we're in and the global demand for the same things. So these are things that we had ordered and they were in process of coming in, but we suddenly ran out. So rather than shut down a network of 15 labs in the country, I put out that tweet. And while we got a lot of criticism, which I expected that we get, something beautiful happened, which always happens in Nigeria. People came back and solved that problem. People came in from that I had no idea where they were and brought those extraction kits. Some of them offered to give it to us for free. They had it in their warehouses. Yes, in Nigeria. So, you know, in every adversity, this country will continue to surprise you by its spirit, by its people, and by its ingenuity in terms of how to solve that problem. So yes, I took in all the criticism on social media in good faith because I solved the most important problem I had to solve on Saturday. Get our labs working again. Now, there was a question about the Roche equipment. What we have in the moment in the country as we speak is a capacity to test about 50,000. This is with the conventional RT-PCR and the new Roche equipment that we have launched today. So the challenge at the moment is all the other things that have to happen. The swabs to collect samples, the virus transport media, the people, and we're coordinating all of this. So with every new lab that we set up, we just set up a lab in Sokoto. It means we have to provide the lab in Sokoto with the logistics and everything they need to collect samples. And we're looking to do this in 36+1 states. So in every new lab comes a new opening for challenges around logistics, collection, travel, transport when there are no flights going. So people have to actually go by road through all the multiple checks. So I just want to assure everyone, we are trying, but it's not easy. If anyone has easier solutions, please, we'll be happy to take them on board. There was a question about Akwa Ibom State. It's not up to me to get involved in who the state recruits or who it reassigns to its duties. The only thing I want to say is the state epidemiologist in Akwa Ibom, Aniakeme Uwa. He was a great colleague, did his work. He's been in that position since 2011. One of the great colleagues that we worked on the Ebola outbreak together. So I'm sure he's been given a new task that will bring out the best in him. So I'll let the government of Akwa Ibom to sort out and continue the internal reposting. I've seen, of course, we have seen the 1-minute video out of Senegal. It's been sent to me about at least 500 times between when it emerged this morning. So our responsibility is to look into it. We know the company. It's a UK firm working with the lab in Senegal. We're in touch with them already through the Africa CDC, and we'll look into what the options are. The fact is that it's not available yet. They're looking for a delivery time, a time to fully develop in June, and then we'll start looking at the possibilities of expanding its use. They've agreed to a central distribution mechanism through the Africa CDC directly to countries so that they will manage a bulk purchasing arrangement. So we'll continue speaking to them and make sure that we have access. On a very interesting question on private labs, and we actually have a fantastic announcement to make. This weekend, we approved the inclusion of a firm called 54Gene to start testing in the private sector in Lagos and Ogun State, and we're currently in discussions with them to move a part of the operations to Kano. But this hasn't been a simple process. They have worked with us for 4 weeks to develop their processes to optimize their biosafety arrangements. So the issue with biosafety is not something you can compromise on, because this is a virus. If you don't have the right biosafety environment, you end up with a situation where the laboratory scientists themselves become infected. And that's one situation we really do not want. So we are moving. There are firms. We have 2 labs now in the private sector, DNA labs in Kaduna, and 54Gene that is now working in Lagos, Ogun, and by next weekend in Kano. So we've set up the process, and we hope that by doing this, we will continue growing our network of private labs across the country. Rachel, can you remind me of your question? Yes. Yeah, so like I said, we have the new Roche equipment that we're starting to work with today. The good thing about it, it eliminates the need for certain things like the extraction kits, so we can actually do a lot more work and do quickly. If we have all the samples in the lab, so if all the collection happens from the States, we can do up to 900 to 1,000 samples in a day. So really, there's a lot of capacity to test now. The challenge is to bring in the samples quickly and get the equipment working. And this really has been in collaboration with many partners that have enabled us to get to this stage. People in the UN family, the US government, and a lot of other partners with whom we're working. The Honorable Minister of State answered the question on Imo State. There are only 4 states at the moment that haven't reported a case in Nigeria. Cross River, Kogi, Nasarawa, and Yobe. We are looking at the numbers of samples collected from these states. We are not satisfied with the number of samples collected. So we need to test more. But to test more, we need to collect more. And that collection part is the responsibility of states and their public health teams. So we want to really encourage every state in Nigeria. You can't hide this. So eventually it will emerge. It's better we understand what is happening early than leave it till we start hearing stories of deaths. So we are really encouraging the public health teams in these states to push out. There are people that have pneumonia, acute respiratory infections in your states. There's absolutely no doubt about it. Please collect samples, send them to us. Let's test, let's know whether you have this thing circulating in your state and mount an appropriate response. If it's not there, but we cannot know if we don't test. Thank you. And just to say, PS, very grateful to have members of my committee and the chairman of the Committee of Health join us for this press conference today. Welcome, sirs.
Thank you. We'll make a slight adjustment to the responses. I will take the Honorable Minister of Humanitarian Affairs so that she can go and attend to other matters.
Thank you very much, PS. The chairman of the task force, members of the task force, distinguished senators of the committees here with us this afternoon, distinguished members of the press. I have 4 questions. One is on the issue of the rice distribution. As you may recall, we mentioned here that we distributed this rice relief to the states. This rice was handed over to us by the Nigerian Customs Service and was assessed by NAFDAC, who issued a clearance before the goods were released for onward distribution
to the states. So as far as we are concerned, this rice was certified and is fit for human consumption. We had an issue in Oyo, which was officially reported this morning. But 2 or 3 days back, we've seen news flying around that all the rice that we took to the southwestern part of this country is bad. That Lagos have taken their own to the lagoon, and other states have rejected. I want to say here very categorically that that is fake news. It's not true. Even as of this afternoon, I spoke with the chairman of the Nigerian Governors Forum, and he assured me that the one he received in Ekiti and other states are in good condition. Let us be very clear on this issue of rice. We all know that even in our houses, if we keep foodstuff, especially grains of that nature, in a damp place, it's bound to have some coloration or change in color. But that does not mean that it is not fit for human consumption. Doesn't mean so. So please, this is what I can say on the issue of the rice. They are very happy that federal government has come to support them and is going a long way in alleviating the sufferings of the targeted beneficiaries. The other issue of diverting payments for N-Power to address COVID-19. This N-Power has always been N-Power, N-Power, N-Power. But I know that we all know it's practically impossible for anybody, be a minister or a chief executive in this country, to divert funds that have been appropriated that are in a particular budget line to another budget line for the simple reason that we're operating the TSC. It's just not possible. So I don't know how we can divert Empower funds for the COVID-19 response on palliatives. That is another fake news. And please, Honorable Minister of Information, I hope you will be coming to my rescue all the time. You know? The other issue is on we have, if we have any monitoring and evaluation mechanism in place for the fact that we are handing over these palliatives to the states. I've mentioned here time that it is a structure that we are following, and it involves national, state, and local government committees. So we are not just handing over and going. We are working with the states for coordination and supervision. We are part of that structure that we're doing this work. And also, the ministry has engaged CSOs and NGOs, including the Red Cross, National Society for Women Council, and Women in Business, and also the CSOs on COVID-19 in the monitoring and evaluation of these processes. Action Aid is one of them as well. And the issue of the women being, I don't know whether the women are being marginalized, our intervention is targeted to poor and vulnerable in the society, including women that fall within this group. And we have a particular Women in Business that we're working with. And I mentioned also the National Council for Women's Society that is in every state of the Federation. So I don't think these people will allow women to really be marginalized. I'm also a woman. I don't think I will allow that. Yes, and I think these are the questions. Yeah. 3 or 4. Thank you very much for your attention.
Thank you. I think I had only 2 questions for a change. So the first one had to do with banks. We continue to engage very closely with the financial sector to make sure that banks operate skeletal services. I know some of the branches are open, but they're probably inadequate. As you know, this is banks are generally in the private sector. All we can do is to work through the established institutions to make sure that they continue to provide services. I have already spoken to the CBN governor just a few days ago on the same issue, and we are appealing to banks to please respect the exemptions that Mr. President has put in place and continue to operate services to customers. This is the only way that we can kickstart our economy once the COVID pandemic is over. With regards to tests, there was a question about testing, whether we have readjusted the protocol for testing. In actual fact, we're strongly encouraging more and more tests to be done. As the DG NCDC said, we are far from exceeding our current daily capacity for testing. And we note that not a lot of states, but some states actually have sent less than 10 samples. And I don't believe that there are no patients in these states that do not have symptoms of respiratory tract infection. And as we know, we have expanded the indications for testing beyond just people who have traveled abroad or have been in contact with COVID. We're now encouraging all those presenting to hospitals with a respiratory tract infection to be tested for COVID. And I'm appealing to particularly states that are in this situation to make sure that they send samples for testing. Thank you.
Thank you very much. We will now take the chairman of the Presidential Task Force, the SGF.
Let me start with the issue of the pensioners. Did you say Federal Mortgage Bank? Yes. Pensioners? Yes. Well, fortunately, the managing director of Federal Mortgage Bank himself just sent in, a lot of people are watching this program, just sent in a message that he doesn't owe any pensioner. He has paid up to the month of April. So the issue of pensions is kind of a difficult issue because I know that there are different agencies that deal with pensions. Even went further to explore to see where they fall. PITAD, as far as their records of pension payments are concerned, they are paid everybody until the end of March. PEMCON, which deals with new pensioners, has also paid until the end of March, and they are working on the April payments. But if there is a very specific case, I know that all these agencies keep revalidating or authenticating and asking people to come and do documentation. Channels, if there is a very specific case, you can supply me with the details, and then I'll forward it for the consideration of the organization. But the responses I've received in respect of pensions from these three organizations, Federal Mortgage Bank, PITAD, and also PEMCOM, is that they are up to date with the payment of their pensions as much as they can. Al-Majri's quite a tricky question, whether their rights are being infringed. I think we have to look at the issue of the Al-Majri's in context, because the movement that is ongoing, from the information I have, is a decision that the Northern Governors Forum took, looking at the scenario and looking at the kind of issues that are confronting us now as a nation and the likelihood of its explosion in the future. You must have seen the pictures of the people you are referring to. Most of them are minors. Most, if not all. As a matter of fact, by the time they get to their teens, they mature and become the malams. So most of them are minors. And I think every government has a responsibility given to it by the Constitution of the Federal Republic of Nigeria, I think Section 14.1, to provide for the welfare and the security of its citizens. And I believe that the governors that are taking this action have that at the back of their mind. That in the state in which these almajiris are operating, can we say that their welfare is being taken care of? Is adequate security being provided for them? And being minors, somebody has to take that responsibility. And I said we should look at it within the context. And I believe that notable northern leaders have spoken extensively on the issue of the almajiris. The former emir of Kano, very passionate about it, and I know the Sultan has spoken about it, and key leaders in the north, that if we do not deal with the issues relating to the almajiris, we are building an army that would overwhelm us as a people and as a nation in the future. If we do not cater for them and provide for their welfare and turn them into productive citizens, there's nothing wrong about them learning the dictates of their fate. But we must prepare them equally for the future. Equip them, skill them, so that they can become educated in their faith and also productive citizens in the future. If not, we are building an army that will overwhelm us in the future. So I want to believe that the actions that are being taken by these governors is in context to provide for the security and the welfare, realizing that virtually all of them are minors. And somebody has to take that responsibility. Because unless you attain the age of maturity, you don't have much right of your own. Somebody has to act on your behalf. And I think the governments are taking over that responsibility to ensure that they take them into safety, especially with the current COVID-19 pandemic. Look at the way they live, how they congregate. In large numbers, the way they eat. If one of them get infected, you can be rest assured that the exponential number you will see among them will be a very scary picture. So my assurance is that these things are done in the best interest of these minors to be taken into safety and their welfare catered for. So I'm not sure I want to agree that their rights are being infringed on. Instead, it is safety and security as enshrined in the Constitution that the governors are trying to provide for them. Media palliatives. I thought that question ought to have gone to the Honorable Minister of Information and Culture, because he has the authority to speak on behalf of the persons that are involved in the media climb. But let me say this, and it should be understood in context. I believe strongly that after COVID, our entire approach to engagements, employment, and the safety of our workplace, and the general packages and purposes that go with certain kind of employment would have to be rewritten. I do not see us going forward as a people and as a nation in the same manner in which we are now. So this provides an opportunity for people to go back and sit down and renegotiate the terms of their employment. What we have done through the Ministry of Health is to ensure that those that are under the umbrella of the federal government are provided with the appropriate incentives, allowances, hazard. I believe that even those that are in the private sector are entitled from their places of employment first. They are entitled to some cover. And I believe those are some of the things that we should be looking at in the future. But I will leave the other consideration to the Honorable Minister of Information and Culture. He might be ingenious in coming up with a proposal as to how to proceed in that regard. But I know that media people, journalists, also are in the line of duty. Because when you go to cover war in the war front or in the places of insurgency and trouble spots, or in a situation of a pandemic like this, you are in the line of duty. I quite agree with that. I do not want to trivialize that. I quite agree with you. You are in the line of duty. And to some extent, there should be some measure of concession. And that's why I'm saying that I will leave that to the Honorable Minister to see what he does about that. Salaries. I have it on authority that the banks are operating. I'm coming. They are operating because if you shake your head, I will tell you that I got my alert. And it's true. It's true, I got my alert. The offices are not working, but I got my alert. It's the system. It's the system. Banks are operating. As a matter of fact, the central bank have confirmed to me that they even gave an instruction today that all the banks, in spite of the fact that they have been asked to give skeletal services, have also been directed as from today to accept checks for clearance. One of the things that they have also been considering is the issue of cash movement. You know, everybody is protective of himself. Nobody wants to handle cash, but I understand that they are taking deposits from their major lodgers. People who transact major businesses are allowed to bring in those cash because it is even dangerous to keep it wherever their trades are. So, but I've been assured that banks are paying. Salaries are being paid. I can confirm that as a public servant, I've received mine. I do not want to think that some people are playing games, wanting to come under the cover of COVID-19 and not pay salaries. I'm not suggesting that, but it's a thing that I think we should truly interrogate. Find out why certain organizations or corporations are not paying, because I think most organizations have digitalized their payment methods. That salaries can go into your account without you necessarily being there. And just by the press of a button, these things will be affected. So I want to assure you. But if there are certain specific issues, let us know so that we can escalate it. To see that those decisions are reviewed. The Apex Bank, which is the CBN, have assured us that they have given instructions that online transactions should proceed. People can make withdrawals from ATMs, and they are restocking the ATMs on a daily or another day basis to ensure that there is cash available in the machines. And they have now instructed that transaction with checks in terms of clearance should begin from today. I think I've answered all the questions that are standing here. Let me take this opportunity to welcome the chairman of the Senate Committee on Health and the vice chairman of the Senate Committee on Public Health. Thank you for attending today's press conference. Thank you.
Thank you very much. That brings us to the end of today's national briefing. There's a reminder here. There's a broadcast at 8 p.m. You are reminded to please look out for the broadcast and listen attentively. An important message has come out of today's briefing. It's that the fight against COVID-19 is a fight for all of us. This is a time for leadership. This is a time for collaboration. This is a time for unity of purpose. God bless Nigeria. We hope to see you tomorrow after the broadcast.